to take the lead in tackling societal problems. And then that is achieved through a tripartite relationship, a tripartite partnership between the government and the social sector. Now, the social sector includes the non-governmental organizations that are involved in care, and then the private government, of course, includes the ministry and the other levels of government, because they are involved with policy making, and they have all the authority and the influence. And then you have the private sector is where they make the money, and then you have the social sector, which is involved with care. So all the CECP is bringing all this together to see that we have these things happen. And this is not something that is unique to Nigeria. It is something that has happened in other places. Like I mentioned, in the United States, I mentioned India. It all started with the private sector taking the lead. For instance, the first comprehensive cancer center in India was established by a man called Tata, Sadorab Tata. It was established in 1941. That was 6 years before India gained independence. And the reason why what led to it was that his wife had leukemia, which is blood cancer. And at that time, there was no center in India. So he had to take his wife abroad. But on his return, he decided to establish one in India. That was how it was established. In the United States, too, the American Cancer Society started the move that brought the high rate of cancer survivorship in the United States. Cancer also used to be a death sentence. But some doctors and some businessmen, supported by some businessmen, started the advocacy, the campaign, and it was only several years later, about 60 years later, that the government got involved and now made laws and all that. And so we now have strong involvement of the government in the fight against cancer. And so it is something that we've seen that the private sector has to get involved. And according to the Minister of Finance, he keeps saying that the private sector needs to get involved in the healthcare to make things work out. For instance, doctors just came back from strike. And if we keep having all this, with the present infrastructure we have, we cannot sustain it. We keep having strikes, patients are on admission, and then especially with cancer, where time is of the essence. You have a cancer patient is in the hospital, and the next thing, doctors are on strike, and then you find that these patients will stop receiving their treatment and care, and things will start going haywire. So the private sector needs to get involved to make things work out effectively. They need to bring their efficiency into it, and that's what is coming to play with the CECP
What
campaign.
has been the response that you're getting from the private sector so far? Has it been encouraging, or has it been quite disturbing?
It is, well, it's
Sweet and sour.
Yes. But one encouraging thing that happened was that the Nigeria Stock Exchange, which is one of the co-promoters of the CECP, on the 17th of May this year, got all the quoted companies to come together, and they had a corporate challenge against cancer. So these companies were supposed to have registered, and then they register for the race. Then after the race, the funds will go towards the mobile cancer center. It's held, like I said, last month, and we had about 50 companies that subscribed to it. And we don't have the exact amount that have been raised. They are still collating. Okay. But that is one positive thing towards the mobile cancer center. And now we have this event that's coming tomorrow, and we expect that all the everybody, whether you're a corporate organization or as an individual, we expect everyone to be at the event, which is taking place at Eco Hotel tomorrow from 2 p.m. at Eco Hotel. So we expect everybody to come together, and let's fight this cancer to a standstill.
So the work of CECP in terms of advocacy, does it extend to support and help for those who have cancer in real terms?
Now, the major focus is on prevention, because we know that prevention is much better than cure. True. It is much more expensive to focus on treatment. Like I told you, to really treat cancer cases effectively, you need the comprehensive cancer centers. Like I said, one comprehensive cancer center will cost at least 10 billion naira. And with our level of decay in infrastructure, we cannot just go up to the comprehensive. We have to start with something that is easier. And so that's why we're looking at, because when you start with this taking prevention first, you find that you tend to have less advanced cases, because most cases will be picked up very early. Most cases will be picked up in the pre-cancer stage. For instance, cervical cancer, colon cancer, and some other cancers have pre-cancer stages. So if people are involved with screening, they are likely to pick them up in the early stages, and then the treatment at that stage will be much, much easier. For instance, cervical cancer treatment, the pre-cancer stage, takes just 15 minutes. That is all you need to treat it, and the person will be cured. But you end up spending millions when it is full-blown cancer, and then the person may end up dying. So the focus is on prevention, because it is cheaper and it's also much more effective.
So like, how many people have you been able to assist since the program started?
The program, the main focus of the program is to acquire these mobile units. So we have not yet acquired these mobile units. So that is the process that is on now. So when the units are acquired, then they will now start going around the community to carry out screening and treatment. So the first thing is for us to acquire these mobile units, and then we can now go on to start because when we have these units, for instance, in Lagos, if we have only one, we can roster the different communities in Lagos, and then the units will start going around. But by the way, the units will be operated by a body called the National Cancer Prevention Program. This body has been carrying out screening and treatment for since 2007, and over 100,000 people have been reached since then. So,
is this in Lagos State?
Yes, it's in Lagos, but the main center is in Lagos, but they are not limited to Lagos. They go around the country, different parts of the country to carry out, because the focus is on community-based screening and treatment, not just sitting down in a fixed place. And that's the focus. So they go to different parts of the country. So, but without mobile units, it is very difficult. Imagine that over these years, 100,000 people have been screened. And meanwhile, we have millions of people in Lagos. For us to be able to reach more people, we need to have these mobile units so that it can be logistically easier to reach people.
How far can the mobile unit go? Across the country, or just primarily for Lagos and the Southwest?
The focus is for us to have at least one in each state and Abuja. So if we have, so that's like 37 of these mobile units. So each state will have one. And so that's when you have one in each state, you roster the communities, and then it goes round. We need more than one, but for now, let's start with one, and then we can scale up.
How about your sensitization programs? Because it's another thing to have the mobile units set in all of these communities. It's a different ball game, and you bear me witness, to get the people to come and get it.
Exactly. That's why all this advocacy has been on. Now, even before the mobile units have started coming in, you know that there's a lot of awareness going on now in the media and all that. And then when it now comes to when the units arrive, the plan is to have these schedules in such a way that every community will know way ahead of time when the units will come to them. And so you have people that will go to the team, the mobilization team, that will go ahead. Maybe before they go to this community, they will be there for like a week before the screening to sensitize the people. So that, and of course, there will be a lot of community involvement, involving the obas, the heads of the community, so that these people will facilitate mobilization of the people. And so they are likely to have more uptake of this preventive care. Okay. So that is not a problem at all. It's for us to have this unit. And with this awareness that is going on already, a lot of people are already awaiting these mobile units. People are calling in to say, when is this going to come? So it's not going to be a problem for us to get uptake.
It is supposedly a known fact that cancer is not a respecter of persons.
Exactly.
And that being the case, there will be quite a few people who are dignitaries, who are eminent Nigerians, who are in government or out of government, in private sector, whose family, whether close or distant relations, have already experienced what you're talking about. Who are they and what are they doing to support this? Are there some of them who are actually in the forefront of this advocacy and saying, well, my cousin, my family, my friend, my daughter, my whatever it is, has been involved in someone, we've lost somebody in our family who has suffered this, and if only we have this or we had this advocacy 10 years ago, and we now have a mobile cancer unit, we will not have lost